and you're doing this, and you stop, someone might have a nice diagram, your eye shakes and they can't hold it in place.
Is that common with people with albinism?
Not necessarily. It all depends on the individual nerve it's affected.
That's also how a police officer can tell when someone's in trouble.
Oh, absolutely.
Why?
Because
They'll get their eyes all over the corner, and their eyes start shaking.
and then they check, I don't know. I was told once by the Highway Safety Patrol you should never drink and drive. You may hit a bump and spill the whole thing. No, I'm not condoning that. Okay. Put a lid on it first, that's right. Drug interactions, as you can see, there are quite a few. Dilantin is one of the medications that generally is taken alone. There's on a number of medications. This one's taken an hour before you take any other medication, or a half hour. Always the case, not necessarily, depends on the person's body, their how they respond or react to it in the presence of other medications. But for the most part, they're taken alone. And then this medication decreases the effects of what you can see up there. So you can't have seizures and sex because oral contraceptives are no good. Just for your own. Let's try that. Nursing interventions, as you can see up there, you can read that on your own as well as I can just talk it up here. Drugs for Parkinsonism and Alzheimer's. When I was a kid, somebody over the age of 75 act goofy. They were I can't remember the word. They were senile. Oh, they're senile. Okay, brain's not working anymore. Well, what happened was all of a sudden they found a cause Alzheimer's. The only way to truly diagnose Alzheimer's is with an autopsy. Take part of your brain out and see if it's degraded. Yep, they had Alzheimer's. Otherwise, they can't. It's all on suspicion. Well, what happened was that they saw this kind of stuff and they went, we have a name for it. So everybody who acted goofy had Alzheimer's. And then they realized, well, there's other conditions as well. So it was overused a lot. I think by this age it has come into its own and is being diagnosed appropriately. Parkinsonism, you have chronic neurological disorder, you have degeneration of the dopaminergic neurons, imbalance of the neurotransmitter and less dopamine. What all that means is now we do not have control over our fine motor movements. And we have sporadic issues with activity because the neurons are not firing appropriately. There's Muhammad Ali today with Parkinson's. And that's a picture of him just after he changed his name. Little difference, huh? You see pictures of Michael J. Fox, you see the same thing? You know, most of Michael J. Fox's changes are because he's old. Just like the rest of us. Characteristics, as you can see, and treatment. You're trying to get the right balance of enzyme into the body so that the neurons will fire effectively. Does not always work. Ogetin and Artane. There are new medications that are out that I don't have my slide yet. But the action, as you can see, we slow down the synaptic responses of the nerves. Nursing intervention is, again, you look at how the body is being affected and you take appropriate action. Other medications that are used for Parkinson's as well. Questions? We're still doing the same thing as we did with the previous medications. This is just a further explanation of that, and I have a whole slide dedicated to this one medicine. Hint, hint. Okay. This is an explanation of dopaminergic and gives you a little better feel for exactly what is going on. You can read that at your leisure.
Now, when is this one used?
Where, what?
When is it used?
For the Parkinson's? And if you look at this, all these things, we are doing the same thing, aren't we? Same action. The use is pretty much the same thing as we're trying to treat the symptoms of the disease. This will not cure the disease by any means, but increasing or improve the symptoms so a person can have a normal lifestyle as much as possible anyway. And nursing intervention, as you see. The one down toward the bottom assess suicidal tendencies. The medication can make you depressed, and once you are aware of the disease and where it's going to take you, it causes other depression. We have to be aware of that. Alzheimer's, restless degenerative disease. It is a fatal disease. In very rare cases, does Alzheimer's kill the individual? It's other issues that cause it. One of the most common is a systemic infection caused by UTI. Here we have normal nerve. Here we have nerve on Alzheimer's. See how we don't have any coordination or that of the neuron itself. Characteristics, if you have anybody with Alzheimer's, you work with it, you tend to understand this. Different medications that are used will improve the symptoms. Again, that does not fight the disease, but it improves the symptoms to a point to where the person can function a little bit longer. They will eventually fall into the different stages of Alzheimer's. However, this can decrease or slow the person's slide into the other stages. Keep them at a mild or moderate stage without going into a severe stage. Side effects of medication will cause, or as shown, not much different than the other medications that we've been dealing with the central and peripheral nervous system. The side effects are pretty much the same. Again, you have to look at what it's doing to the nervous system and not what it's doing to the particular organ system itself. Understand where it's used and how it's used, but you realize the action is on the nervous system, not on the brain, not on the arm or whatever, but in the nervous system. And continue nursing interventions. Safety, this is the biggest one. We have a thing called sundowner syndrome, where right about sundown between 5 and 7 o'clock, they come alive, and then they start getting in all kinds of trouble. Need a break?
No.
Okay. Haven't warned you yet. All right. Myasthenia gravis, autoimmune disease, lack of nerve impulses, muscle responses. You tend to get flaccid muscles. You don't get the rigidity or the strength that you normally would have because of the lack of acetylcholine reaching cholinergic receptors. Again, caused by the nervous system. I have no idea what was there, but it's gone now. Oh, wait a minute. I hit the wrong button. Okay. Medications that are used for this: short acting, ultra short, intermediate acting. Again, to help with the transmission of neuromuscular impulses by preventing destruction of acetylcholine, which now works on the, what were those two things? What were they, remember? The nicotinic, and what was the other one? Okay. And it helps to increase the neurotransmission, so now you have more muscle tone, skeletal muscle, smooth muscle. When it's first given, the person is put on again, peak and trough. They're put on, well, not peak and trough, that's wrong terminology. They are monitored for blood levels to make sure that they have the therapeutic level in their blood in order to have the corrective dose, so we don't have too little or too much. As you can see, the symptoms of overdosing or underdosing are both the same because we're affecting the acetylcholine. Myasthenia crisis, underdosed, extreme muscle weakness, and then overdose muscle paralysis. Remember, working with skeletal muscle and smooth muscle, right? What's the cardiac muscle made of? Smooth and skeletal muscle combination makes the cardiac muscle. So we're affecting the heart, and we're affecting the gut and the skeletal muscles, right? Okay, again, each system does not work in a vacuum. And as you can see here, triggers for this.
So it weakens the cardiac muscle.
Yes. And eventually causes either severe placidity of the diaphragm or rigidity, and then causes the not being able to get a good respiration, and at the same time not causing the cardiac muscle to work. So you have a kicking them while they're down. Side effects, you can see a lot of similar side effects from the other nervous system drugs, aren't they? It's almost be memorized by now. Nursing intervention, do the right thing. The antidote is atropine in order to increase your nerve responses, if you will. Multiple sclerosis, again, an autoimmune disorder. And the severity can be anything from mild to very severe. I had a secretary, by the way, had MS. She did very well for a secretary for 3 years. And then the 4th year she started declining because she couldn't work anymore. The medications that are used for this are as you see on the board. We use immunosuppressants, which tells you what? Okay, watch for infections and so forth, and keep them as healthy as possible because we are reducing their immune system to prevent the autoimmunity. Skeletal muscle relaxants are used, essentially acting muscle relaxants, as you see here. With the MS, we have muscle spasticity. So you have muscles tend to collapse on the extremities collapse on themselves. You got to remember that the flexor muscles are stronger than the extender muscles. That's why when you have spasms, you go like this rather than going like this. And you see somebody in the nursing home who's old and they don't have the strength anymore, and then their arms and that tend to curl up because the flexor muscles are stronger than the extensor muscles. And then here we're just trying to relax the muscles again. And the side effects, as we see, pretty much the same as all the other ones. We just added double vision. Nursing interventions, you're not allowed to drive. Not cut abruptly and so forth. These are acting upon the central nervous system, not only the muscles themselves, but they act on other body systems, as we've already talked about. Question? Whoa, did we do this or what? Okay. Again, on Wednesday, Abby will be coming down to administer test on Wednesday. So you don't get out of it. So at 1 o'clock, and she will be doing everything I do, timing or whatever else. Don't ask her a lot of questions about what this means because she won't be able to tell you. Try to figure it out. For posting the grades will not be posted until either late Monday or early Tuesday. I understand that, but I can't do it from California. Thank you very much.